Hi, my name's Darian. I am doing my head to toe assessment on the bear. I already introduced myself. I already completed hand hygiene. I provided privacy for the patient, and I'm going to explain the procedure. So I'm going to walk in and I would introduce myself, like I said, and I would ask the patient, can you state your name and date of birth for me? Okay, perfect. And then, do you know why you're here today? Okay, yeah, we're just gonna assess your lower extremities as well as your abdomen and make sure everything's looking okay. So if I already have him in the position that he needs to be in, he needs to be supine with his arms comfortably at his side, as he is. And so now I am going to just start with assessing the skin symmetry. So I am going to be doing some touching today. I have already applied gloves. If you have any uncomfortableness or if there's any pain with anything that I'm doing, please feel free to stop me so we can assess that. So first I'm just going to kind of look at the skin and make sure everything looks okay. So it's the skin is pink, warm, dry on the abdomen here, and it is symmetrical. The contour symmetry is symmetrical. And then I'm going to auscultate your bowel sounds and your vascular sounds and make sure everything sounds okay. So I'm going to listen in all 4 quadrants. So okay, so the bowel sounds, they are normal active in all 4 quadrants, and there is no bruit noted. Now I am going to, sorry, there's something in my eye, going to perform light touch sensation. I'm just going to not light touch sensation. I'm going to lightly palpate the abdomen and see if there's any tenderness anywhere. So I'm going to lightly palpate your stomach, and if you feel any tenderness or any muscle guarding or anything, just stop me and let me know. So palpating in all 4 quadrants. Any tenderness? No? Great. That's what we want. Okay, so have you ever had any urinary retention or anything like that? No? Okay, well, if you did, I would palpate your pubic symphysis right above the bladder, and I would ask you if, if you need to go to the restroom or if you've had any urinary retention recently. So since you don't, I'm going to make sure that your bladder is non-palpable, which it is. So, now I'm going to move on to the lower extremities. So down here, we're going to kind of look at the skin first and make sure it's pink, warm, dry, and smooth, which it is. The hair is evenly distributed. If they didn't have any hair, so they shaved, like most women, I would say that the skin is, smooth, pink, warm, and dry, but shaven. So I'm just going to test your cap refill here as well. So cap refill is within 3 seconds. I do not note any edema or varicosities, so that's good as well. So I'm going to move on to your pulses. So I'm going to do your popliteal, which is behind the knee. Okay, and that's good. And then I'm going to do your dorsalis pedis, which is right on top of the foot here. And then your posterior tibial, which is on the inner ankle, around that area. And all 3 pulses are 2+ equal bilaterally, and they are regular. So next I'm going to just test some muscle strength. So I would stand at the end of the bed and I would have the patient, I would push against their feet and have them push back. I would pull against their feet, resistance, and then I would also make sure that they rotate their ankles and make sure that they can rotate them properly. I would also make sure that they can bend their knee and then while the knee is bended, move it out and then move it back in and then lay it down on both sides of each foot, or each leg and foot. So I would do that, and then I would state that the lower extremity strength is strong and equal. bilaterally and that the full range of motion of the ankles, knees, and hips is intact. So next I'm going to move to the light touch sensation, where I'm just going to kind of have the patient close their eyes and not look at me while I'm touching them in certain areas. So I would maybe just touch the top of their toe and then ask them, you know, where they felt it. And they would tell me. So then I would tell them the light touch sensation is intact. And then I would go ahead and move on to the gait. So I'm going to have my patient sit on the side of the bed and make sure that they're sitting evenly, and then that they would stand up and then walk from one end of the room to the other and make sure that their gait is steady. So I'm going to go ahead and say I did that. So that concludes my head to toe assessment. Thanks for watching.